Welcome back to Living Well. We are on location at Heddington Oaks, and I'm joined by Beverly Turpin. She is a nurse liaison here at Heddington Oaks. And Beverly, forgive me, because before I met you, I did not understand what a nurse liaison did. Can you give us a sense of what your job entails?
So I start with when we get the referral from hospitals or any other healthcare facilities, I would do the screening part of it. So it's a pre-admission process.
Okay.
I go over with the clinicals that involves history and physical, progress notes, medications they're taking, what type of equipments are they needing once they get here at our facility, to help with a smooth transition from, like I said, other facilities to our here while they're staying at Heddington Oaks.
And so once you have all of that information, then you're able to provide that to the therapist or whoever's going to make sure they have whatever equipment that they need.
That's correct. We want to be more prepared. We anticipate their needs. Some equipments we need here, we do not have stored right at our facility. So we want to make sure that, you know, say if they need BiPAPs, CPAPs, are they on IV, IV antibiotics? Just anticipation of
always being prepared for whatever they're going to need when they get here.
Yes, and we want to do that prior to them getting here, of course.
So what's been your experience when you meet patients for the first time in the hospital? I would imagine it's a little scary or overwhelming to think about the rehabilitation process.
Right, okay, so they would ask, how many times do I get to see the therapy? How long am I going to be in therapy? So those types of questions, all I can say is that once you get admitted to our facility, the therapy group will come and evaluate you, see how much you can do, endurance, how much strength do you have once you get to the facility, and then determine the time, you know, you will be seen. Because of course the therapy is the only people that can answer them to that questions. And then I would advise, of course, to have someone with them, because that is one of the challenging parts when it's just the patient dealing with the discharge process. It's nice to have someone that are able to
help understand the information.
Exactly. And I would advise them to call the facility, schedule for a tour. Any questions that you may have, sometimes I don't have answers for those, but I will find someone that can answer that questions. I just want them to feel good, once they get here.
How meaningful is it to you to be able to provide that level of care before the patient gets here?
It's fulfilling for me, making sure, because it is a big transition for them, for patients coming to our facility. I want them to feel good about their experience, to meet their needs, understand their goals. It's good feeling.
And very important stuff too. Beverly, thank you so much for being with us here on Living Well. Living Well, we'll be right back.